Hello everyone, today we'll discuss about dialysis. Dialysis is a procedure which is performed in cases of renal failure, and that is to remove waste material as well as toxic substances from the body and restoration of normal volume and composition of body fluid. What is the principle on which dialysis works? Dialysis works on the principle of diffusion equilibrium. Here, diffusion of solutes, that is from an area of higher concentration to the area of lower concentration. When two solutes, they are separated through semi-permeable membrane. In dialysis, blood is allowed to pass through a semi-permeable membrane and it contains dialyzing fluid. The dialyzing fluid has all the constituents which are similar to plasma except proteins. Now, waste products as well as other substances, they diffuse into the dialyzing fluid because the membrane is semi-permeable and they are removed from the body. Now, rate of movement of solutes across this dialyzing membrane, it depends on following factors. The factors are similar to the factors affecting rate of diffusion. So, the factors are, number one is concentration gradient of the solutes between two solutions. If the concentration gradient is more will be the rate of diffusion. Second is permeability of membrane. Permeability is increased, diffusion is fast. Third factor, that is surface area of the membrane. More the surface area, more will be the diffusion. Fourth, that is length of time. Blood as well as fluid remain in contact with each other and the membrane, and more will be the rate of diffusion. Now, dialysis is mainly of two types. Number one, that is hemodialysis, which is also known as artificial kidney, and second one, that is peritoneal dialysis. Starting with first one, that is hemodialysis or artificial kidney. It is indicated in cases of acute renal failure because of circulatory shock, in cases of lead or mercury poisoning. In chronic renal failure also dialysis is required. Here, excretory functions of the kidney, they are replaced by dialysis, but we cannot replace metabolic and endocrine functions of kidney. Now, which are the mechanism of action? As we have discussed, the principle is diffusion of solutes from an area of higher concentration to the area of lower concentration. Procedure of hemodialysis. Here, IV line is taken. You can see in the picture that through IV line, the blood that is pumped from one of the artery, mainly radial artery, is taken. The blood is anticoagulated. Heparin is injected before the procedure to prevent coagulation when blood passes through this dialysis machine. Now, this blood that is entering in the machine, that is passed through a long coiled cellophane tube, and this tube, you can see here, it is immersed in a dialyzing fluid. Now, composition of dialyzing fluid. Composition is same as plasma, but there is absence of waste products like urea, uric acid, sulfate, phosphate or creatinine. Sodium, potassium and chloride ions are also present in less amount. Glucose, bicarbonate and calcium ions are more. Now, when blood flows through the tube, concentration of non-protein plasma solutes, they reach to the diffusion equilibrium with the solutes present in the dialyzing fluid, and therefore you can say toxic substances, that is non-protein nitrogenous substances, they are removed from the blood and normal electrolyte concentration is restored. And now this dialyzed blood returns back to the patient through peripheral vein. Mechanism, as we have discussed, inside the artificial kidney, blood passes through a dialyzer which contains cellophane membrane, that is a semi-permeable membrane which is porous, and therefore urea, creatinine, phosphate and other waste material pass into the dialyzer and essential substances, they pass into the blood. Now, amount of blood in the dialysis machine, that is about 500 ml, and rate of blood flow through dialysis machine, that is 200 to 300 ml per minute. Frequency and duration of dialysis, it is required about 3 times a week, and the whole treatment or whole dialysis requires 4 to 6 hours to complete. And which are the complications? The patient may have sleep disorders, the patient may have anxiety, may have depression. Now, peritoneal dialysis. Here, peritoneal membrane, it acts as semi-permeable membrane instead of cellophane membrane. Mechanism of action of peritoneal dialysis. Here dialyzing fluid that is injected through a needle and that is inserted through the abdominal wall into the cavity, abdominal cavity. And here peritoneum acts as a semi-permeable membrane and therefore there is diffusion of substances from blood to the dialyzing fluid. Peritoneal dialysis, that is simple procedure, it is convenient and it is less expensive. It is OPD procedure also, you can do the procedure at OPD basis, but it is less efficient and chances of infection are there. So this is all about dialysis. Thank you.